Welcome back, everyone. Dr. Linda here. Let's take a look at the next section. This next section is going to be talking about these anatomical quadrants, these regions, and let's take a look at them. So all it is uh, we're drawing a sagittal line like this, or a vertical line, and then this horizontal line right at the belly button, so that we have four quadrants. There is, now remember, when we're looking, even though this is our reading left and this is our reading right, this is the person's or the patient's right shoulder and this is the patient's left shoulder. So this would make this the right upper quadrant and this the right lower quadrant. Then we have a left upper quadrant and a left lower quadrant. Okay, so those are the names of the quadrants. And what we have in those quadrants are different organs, right? It's just an overlaying or a mapping system of the different organs. Now, why is this important to know? It's important to know this because if you're getting into healthcare, and whether you're going to be a nurse or a doctor or a PTA or a physical therapist, right? Sometimes it's important to know that when you're looking at a patient file or notes, and it says, okay, patient came in with 103-degree fever. They were nauseous, they were vomiting, they came in cramped over and pain in the right upper, sorry, let's say they had pain in the right lower quadrant. Now you have to think back to your anatomy and you're going, all right, what do we have organ-wise in this right lower quadrant that can maybe create a fever, cramping, bent over? We have this thing right here called the appendix. So maybe they have an appendicitis, possibly, right? Patient came in, throwing up, nauseous, yellow skin, claims it was insidious onset right after eating a fatty meal, fast food. Patient claims they have some discomfort in the right upper quadrant and right between the right shoulder blade on the posterior side. Well, the gallbladder produces bile. Bile is, I shouldn't say produces bile. The gallbladder releases bile. It's the it's the liver right here, the liver that produces bile, and then it stores it in the gallbladder. And whenever there's fat that's in the stomach, when you consume food, and there's fat in the stomach that gets emptied into the duodenum, the gallbladder contracts and pushes out bile, which is a fat emulsifier. But imagine you have a stone right here. You have a gallstone. And now when the gallbladder contracts and it's pushing bile in this direction, it gets blocked here. So they get a lot of pain in that right upper quadrant. Okay. All right. So be familiar with the quadrants. Sometimes it's just a drag and drop. This line right here is in the sagittal plane. That is a sagittal line. It's important to know. Then we have these 9 regions. Okay, so we have 4 quadrants, 9 regions. You do need to know the names of these. There'll be like a drag and drop on one of the Connect quizzes, I'm sure. So let's start at the belly button. So the belly button is umbilical. So that's the umbilical region, easy to know. So you can knock that one out of the way. Then we have epi, means above, and hypo means below. Epi and hypo are opposites. So epigastric means above the stomach, that's in the center. Hypogastric is below the stomach. And the other name for hypogastric is pubic region because it is close to the pubic bone. Okay, then we have, remember this is the inguinal ligaments. So we have a left inguinal region and a right inguinal region. Those are pretty easy. Then you have a lumbar region. There's a left lumbar region and a right lumbar region. Sometimes they call the lumbar regions the flanks. A flank. So sometimes it's called the left flank and sometimes the right flank. Then we're left with a left hypochondriac and a right hypochondriac. Chondria means cartilage, and it's left hypochondriac region. It's the cartilage underneath the ribs. So we have lots of rib cartilage here. So there's a right hypo under the cartilage, hypochondriac region, and a left hypochondriac region. So again, just a drag and drop, you'd have to, click them, drag them. So you have an umbilical region, an epigastric region, and a pubic region. Left inguinal, right inguinal. Remember, this is their right side. This is their left side. It's not your reading left and right. Don't mess that up. There's a left flank or left lumbar and a right flank or right lumbar. And then there's a left hypochondriac and a right hypochondriac. So straightforward, drag and drop on those. And again, the same concept, the organs don't change. So, it's that hashtag or the number sign in the middle, and the same organs are located just in 9 different regions.